Ever wondered how critical physical activity and weight loss are in preventing cardiovascular events, especially in people with diabetes? Well, you're about to find out. We all know that staying active and maintaining a healthy weight are essential for overall well-being. Regular physical activity boosts our heart health, enhances our mood, and even improves our brain function. And when it comes to weight management, shedding those extra pounds not only makes us feel better about ourselves, but it also reduces the risk of numerous health conditions like heart disease, stroke, and certain types of cancer. Now, if you're someone with diabetes, these factors become even more crucial. Exercise helps to control blood sugar levels, reduce the risk of heart disease, and even improve insulin sensitivity. Meanwhile, achieving and maintaining a healthy weight can significantly reduce the risk of diabetes-related complications. But that's not all. Imagine combining these two factors, physical activity and weight loss. What impact could they have on preventing cardiovascular events in people with diabetes? A study published in the Journal of the American Medical Association's Network Open on February 22, 2024, aimed to explore precisely this. This study wasn't just another run-of-the-mill research. Instead, it was a comprehensive examination of data from the Look Ahead study, a randomized clinical trial involving over 5,000 participants with type 2 diabetes and overweight or obesity. The study aimed to investigate the cardiovascular benefits of an intensive lifestyle intervention, targeting at least 7% weight loss from each participant's baseline body weight. So, are you ready to dive deeper into this fascinating research? Let's dive into the details of this study that has shed some light on this significant issue. So, how was this study, which could potentially change our approach towards diabetes management, conducted? You might wonder, and it's a great question. The research we're discussing today was a secondary examination of data from a larger study known as the Look Ahead study. This was a randomized clinical trial that took place at 16 clinical sites. To give you a bit of a backstory, the Look Ahead study recruited over 5,000 participants between the ages of 45 and 76. All these individuals had type 2 diabetes and were either overweight or obese. The study began back in August 2001 and ended in April 2004. With the researchers following up with participants for about a decade. The original study aimed to investigate the cardiovascular benefits of an intensive lifestyle intervention. This intervention was designed with a specific goal in mind, to achieve at least a 7% weight loss from each participant's baseline body weight. The results were then compared to those who received only diabetes support and education. Now, for this new round, referred to as the sub-study, the researchers had specific criteria for participant selection. Out of the original pool, 1,229 participants made the cut. These included men, making up 43.4%, and women of various races and ethnicities. The researchers then proceeded to examine the accelerometer data from the first 4 years of the study. If you're wondering what an accelerometer is, it's a wearable device that tracks all movements to determine physical activity levels, offering a more comprehensive view than a pedometer, which just tracks steps taken. The researchers also scrutinized the average weight loss during the first 4 years of the study. They chose this time frame because participants received more frequent physical activity measurements, individual supervision, and group sessions during this period of the Look Ahead study. Afterwards, they examined participants' records, looking for non-fatal cardiovascular events, as well as causes of death in participants, which included death from cardiovascular events like heart attack and stroke, and death from all other causes. Once the data was adjusted for several confounders and variables, including age, sex, race, and other medical conditions, the researchers ran several statistical analyses. Now that we have understood the methodology, let's move on to what the researchers found. Eager to know what the study revealed? Well, let's dive right in. The research findings were quite illuminating, to say the least. It was found that participants who demonstrated high physical activity levels, combined with weight loss, had a significantly lower risk of cardiovascular events when compared to those with low physical activity and no weight loss. That's a big deal, isn't it? But there's more. The study also unveiled that the cardiovascular benefits were even more pronounced among participants who lost 7% or more of their weight. This is a critical insight, as it underscores the importance of weight loss in conjunction with physical activity to achieve optimal cardiovascular health. The researchers also found that the more physical activity participants engaged in, the lower their risk of cardiovascular events. But there was a catch. This was only true as long as there was some weight loss involved. It seems that weight loss plays a crucial role in amplifying the cardiovascular benefits of physical activity. Now, what about those who didn't lose weight? Well, the study found something interesting there too. For those participants, the cardiovascular benefits appeared to reach a plateau at approximately 1,000 MET minutes per week. To put that in perspective, that's equivalent to the 2018 Physical Activity Guidelines for Americans. Recommendation of 150 minutes of moderate physical activity, or 75 minutes of vigorous physical activity per week. But remember, these benefits plateaued for individuals who didn't lose weight. This suggests that while physical activity is beneficial, it's the combination of both physical activity and weight loss that really makes a difference when it comes to reducing cardiovascular risk. These findings surely give us a lot to ponder over, don't they? So what do these findings mean for people with diabetes and the medical community at large? The implications of this study are indeed profound, both for individuals with diabetes and for their healthcare providers. The research underscores the importance of a dual approach in managing diabetes and reducing cardiovascular risk, that is, combining regular physical activity with weight loss. This study highlights the significance of not just any weight loss, but a weight loss of at least 7% of baseline body weight. The evidence points towards the fact that this kind of targeted weight loss can lead to considerable benefits, particularly in terms of reducing the risk of cardiovascular events. In terms of physical activity, the study reaffirms the guidelines set out by the 2018 Physical Activity Guidelines for Americans. A level of activity equivalent to 150 minutes of moderate physical activity, or 75 minutes of vigorous physical activity per week, seems to be the sweet spot. However, the study suggests that the cardiovascular benefits of physical activity are more significant when combined with weight loss. For healthcare providers, this study could potentially alter the way they approach diabetes management. The findings may encourage them to place greater emphasis on a combined strategy of physical activity and targeted weight loss. It may also lead to the development of more comprehensive and effective treatment plans that address both diabetes and cardiovascular health. For individuals with diabetes, these findings provide a clear direction. The path to reducing cardiovascular risk and managing diabetes may not be easy, but it's certainly achievable. It's about maintaining a regular physical activity routine and aiming for a weight loss of at least 7% of their baseline body weight. This study brings new hope and direction for individuals with diabetes and overweight, doesn't it? Let's recap what we've learned so far. We delved into the intricacies of a recent study that examined the combined impact of physical activity and weight loss on reducing cardiovascular events in people with diabetes. The study was a secondary examination of the Look Ahead study and focused on over 1,200 participants. We discovered that compared to individuals with low physical activity and no weight loss, those who engaged in high physical activity and lost weight had a significantly lower risk of cardiovascular incidents. The benefits were even more pronounced among those who lost at least 7% of their baseline body weight. Moreover, the study highlighted that higher physical activity volume was linearly associated with a decreased risk of cardiovascular events among participants who lost weight. This means the more active they were, the lower their risk, as long as there was some weight loss involved. These findings underscore the significance of maintaining a healthy lifestyle, especially for those with diabetes. The combination of regular physical activity and weight loss can play a crucial role in managing diabetes and preventing heart disease. So let's keep moving and strive to maintain a healthy weight. Remember, every step counts, and every pound lost is a step towards a healthier heart and a healthier you.